What's your relationship with alcohol? What about marijuana or prescription drugs or nicotine and vaping, all of these different things? What relationship do you have with these different substances? Now, let me clarify. By relationship, I'm not saying which of these substances do you use or not use. I'm more referring to which of these substances are you in connection to and that you experience or see on a regular basis. So to have a relationship with a substance simply means what are the feelings and the thoughts and the conversations and the choices you are making in connection to different substances. For example, let's look at something like alcohol. Whether or not I choose to drink alcohol or not, I very much have a relationship with alcohol because it is so present in our culture, right? We turn on the TV, there's alcohol commercials, there's alcohol in the shows. We read a book, there's alcohol. We go to a sporting event, we go to a concert, all of these things, there's alcohol everywhere. So alcohol is very present in my own life, and in the sense that I have thoughts about it, I have different beliefs and values about it, I have conversations about it, and I'm actively choosing to engage or not engage with it. That is what I mean by having a relationship with a substance. So you can just take a second to think about it and identify what substances do you have a relationship with in your life? Which substances are you seeing on a regular basis? Are you talking about? Do you have feelings about? Are you making decisions about? And what substances are totally absent and you're not really thinking about it at all? So for me, alcohol is one that there's very much a tangible relationship with because it's so present. But as a 37-year-old or nearly 37-year-old mom who's training for marathons, something like vaping is, I really don't think that I have much of a relationship with it because it's not present in my life at all. I'm not really actively having to make decisions about it or even really coming in contact with it. But in your life, it could be totally different, and there could be different substances that you have a relationship with that maybe I don't, or vice versa. Also connected to this idea of having a relationship with substances and ATOD, it's important to understand what the terms beliefs and values mean in relation to ATOD. So when we're thinking about beliefs, these are the things that we know or believe to be true about ATOD, whereas values are the principles defining what we believe is right for us in terms of ATOD. So an example of a belief could be, let's say that a person believes that if they smoke marijuana, it's going to lower their anxiety. That doesn't have to necessarily be true or fact. It's just something that we hold in our core and we believe to be true. Whereas a value is something more about determining what is right in terms of how I'm going to engage with the substance. So possibly a value could be, hey, I really value having all of my mental faculties and being able to have full autonomy over my choices. So in a social situation, so I'm going to not partake in using a substance that may alter those things, that may alter my ability to make decisions, my ability to, navigate a social situation with all of my mental faculties in check. So as we think about ATOD and substances in our life and we consider how do we care for our well-being, how do we live a life that brings us joy, it's really important that we think about these relationships and the relationship we have with different substances in our life so that we can build self-awareness of what's going on with these relationships, what does it look like, how is it impacting my well-being, how is it impacting my best model, all of these different things. Okay, so as we sign off, I just want you to think about what relationships do you have with substances, with ATOD in your life, and how are they impacting your well-being?